I'm pleased to welcome you to the South Carolina Department of Corrections and MUSC Health Chester Medical Center Inpatient Unit. This day is a culmination of years of hard work on behalf of many individuals who have collaborated to construct one of the most secure inpatient units in the state. This security includes over 60 monitored interior and exterior cameras, barred windows, on-site security, and protocols for treating SCDC patients.
It's going to be a 36-bed facility, so what that means is that we would have 36 people, and we generally have about that many across the state in various facilities. So it could be in Charleston, it could be in Columbia, it could be in Greenwood, it could be in Florence, it could be everywhere. But what does that mean for security? Everybody knows we have a lot of staffing issues at the Department of Corrections, and we struggle, just like everybody else in this day and age, to staff our facilities, although we're doing better with the help of the legislature and big raises we just received. That would be about 144, 145 officers who are at facilities throughout the state. Consolidating here is going to be 20 per day, 10 per shift.
We're definitely going to have greater access to better health care. We're going to have access to more options, and that's not just going to be available to the men and women that are in this wing. That's going to be made available to our entire community. You know, we talk about safety, and that's the realm in which I operate in. But our community's got to know that being safe also means having quality health care, having access to quality health care, and that's what this hospital provides. And just because this wing and this service is being added, that's not going to take away from what you're offered here. In fact, it's going to enhance what you're already offered. I want the community to know that we have a comprehensive safety plan in place that we're working with the Department of Corrections, and we're going to make sure that this place is safe. On top of all those things that Director Sterling discussed that's been implemented in this wing of the hospital, we have a response plan in conjunction through our Emergency Management Director, Ed Darby, and the Sheriff's Office and the Fire Department and other public safety entities.
This is a hospital that is a prison also, as you see with the bars on the windows behind me. It's a secure unit. So it's a big deal for staffing. We've had a hard time staffing our search teams. This will allow us to staff our search teams. This will allow us to take those extra officers and put them back in the facilities, which is a game changer for our institutions.
We can help expand the services here at Chester. At Chester Medical Center, who, because they're a rural hospital, they're under constant pressure from just having the number of patients here. Because if we don't have enough patients, it's hard to get enough doctors, it's hard to get enough nurses. So by working closely with the Department of Corrections, they're going to bring a fairly steady number of patients here, and simply because of that, we'll be able to recruit more nurses, recruit more doctors. Communities like Chester are under great pressure to close their hospitals. It's hard to maintain the hospital, but this will prevent that from happening, or make it much less likely.
There's also a locking mechanism here that has to be controlled from the officers inside the unit to let anyone in or out of the unit. You can see that there's also a lock here. There's also a lock here at the door. And this is a keyed entry that the officers have. It's important to note that we cannot go in to care for a patient without an officer with us. So they will come, they will let us in the room, we will go in together as a team to take care of our patient.